Providing choice questions is a very helpful strategy. So a choice is a request that's phrased so the listener has a choice between two things. So when you use a choice as a question, you're providing the information for the person to use in his or her answer. Bob, would you like soup or a sandwich? It's much easier for the person to answer than saying, what would you like for lunch? Okay, once they make a choice, then you add to that conversation. I'm having a sandwich too. I think I'll make it an egg salad today. That's my favorite. And then the person might be engaged or encouraged to state their favorite or make another comment. Okay? Questions that can be answered with a yes or a no will not extend or prolong the conversation, but they are effective means of giving someone a choice if you need to keep something very simple. So, for example, would you like soup? One thing to keep in mind is that quizzing, arguing, or confronting someone with dementia is not going to help you communicate. It will very likely make the person angry or more confused. So think about meeting them where they are. Validate what they have to say and then add to it. And you need to accept the values, beliefs, and reality of the person that's suffering from dementia. The key to is agree with them, okay, but then use that conversation to get them to do something else without being realized that they're being redirected. So for example, if you have an 87-year-old woman that says that she needs to go home and take care of her 5-year-old daughter, okay, you wouldn't say, well, your daughter's 55, you don't need to go home and take care of her. You wouldn't tell her that she was wrong. You might say something like, I have a daughter too, and she loves peanut butter and jelly sandwiches. Would you like to come in the kitchen and help me make a sandwich? Okay? It distracts the person in a non-confrontational way, and then it gives them something positive to do.
Let's take a look at another scenario. The person did poorly on several executive functioning tasks during formal assessment, such as mazes, trail making, and generative naming. The person is living alone in an independent living environment, but each evening the care partner stops over for a short time. Informal assessment was limited, but sticky notes were found all over the home. In this scenario, the clinician gained valuable information during formal assessment. More could have been done during the informal assessment, but some information was gained that could be useful in supporting independence. Goals that are written to specifically address the impairment should be avoided. Training to the testing task may improve performance in that specific task, but will have very little carryover in support of independent functioning. Instead, the clinician should consider what skill is impaired and find a way to compensate for that loss using preserved ability. In this scenario, executive functioning is impaired, but the ability to read and use notes has been preserved and should be developed to improve performance.
Based on findings in research that information is learned and retrieved more effectively when practices are spaced over time compared to consecutive or massed practices, spaced retrieval expands the interval length in between practices. Okay? And there's a lot of research showing that these expanded intervals are a much more effective and efficient way to learn than consecutive or massed practice.
And there's two distinct forms of primary progressive aphasia, and they each have their own somewhat different symptom. So in semantic variant primary progressive aphasia, individuals lose the ability to understand or formulate words in a spoken sentence. Later on in the course, we'll be going through a case study of someone that has semantic variant primary progressive aphasia. And we will talk more about all of these cognitive domains as we proceed through the class. I encourage you to go to YouTube or go online and search for this video that is a virtual dementia tour. And it simulates for people what it feels like to have dementia. And so I encourage you, it's called Virtual Dementia Tour, to look for this and to watch it. I think the video is about 12 minutes, and it's really worthwhile watching to get an understanding of what somebody with Alzheimer's disease is experiencing. In your handout, there's a whole list of programs that are available for people with dementia, and I like to highlight a few of them during our program. And one of them is Music and Memory, and it's an organization that connects people with dementia with themselves through the gift of personalized music. And they have trained professionals set up very distinctive personalized playlists and use this as a type of music therapy to help people tap into their deep memories. So this is their website address, and there's also information on your handout about this as well. So as I mentioned, there is a PDF file that's part of this course called the Rothschild Person-Centered Care Planning Process, and it goes into all of these steps in much more detail. It also gives you blank forms that you can feel free to use at your community to document your care planning process. And there's some completed forms that are case study scenarios.